Hi, everybody. Welcome to Cox Connections. Brad Grundmeyer, Director of Public and Government Affairs for Cox, Louisiana. Thank you so much for tuning into our show. In this segment, we'll be talking to our great friends at the American Cancer Society, as well as happy to have Dr. Terry Kraus, who's a clinical assistant professor in Department of Radiation Oncology at Tulane Cancer Center, and a good friend as well, Ms. Amber Stevens, who's a volunteer at ACS and always doing a fantastic job. Thank you both for coming by today.
You're welcome.
Always love, and I think it's important to promote what's going on in the area of cancer. My mom, unfortunately, 3.5 years of a really tough battle of breast cancer, was heroic in my thoughts and prayers, and she's just truly a hero. But anything we can do to get the word out about cancer, and obviously not let anyone have to say the words or hear the words, you have cancer. And you guys have been today here to talk about Cancer Prevention Study 3, and it's a great tool that's coming about, or a great study that's being put together, and I thank you both for coming by today.
Thanks for having us.
First off, Amber, tell me a little bit about the Cancer Prevention Study 3.
The CPS 3 is a study that's being done across the country, and we're getting people to actually be a part of research. These people will be able, the research that these people, the outcome of the research of these people will actually help them determine why some people get cancer, why some don't. Maybe environment has something to do with it. It's truly an opportunity for anybody that wants to help save lives.
Yeah.
Because the outcome of this study will help save lives.
Well, Dr. Terry, I know that you have obviously a passion for this, and we were just talking a little bit before. The CPS 3 has really come about because we're still learning day by day what causes cancer, right?
This is going to be really, truly one of the most important landmark studies ever done. Mm-hmm. And the reason for it is that with the small blood sample, they will be able to determine an incredible amount of information, not just for today, but 10 years from now, 2 decades from now, 3 decades from now, because they will have a long track history. I predict that out of this study, we're going to have a future world. What do I mean by that?
Yeah.
Your grandchildren, my grandchildren, when they're born, or great-grandchildren, they'll take a little swab of the inside of their cheek and be able to tell from this study, perhaps, that they were prone to heart disease. Perhaps they were prone to prostate cancer, breast cancer. Perhaps even go on the right kind of diet, perhaps have the right kind of vaccines. All of this may happen from this study. We don't know where it's going to end.
Right.
We don't know. The studies at the beginning, CPS 1, the Cancer Prevention Study number 1, told us something that we accept today. Cigarettes can cause lung cancer.
That's correct.
We accept it.
Yep.
We accept secondary smoke. It seems like that's such a rudimentary thing.
Absolutely.
Today. But back then it was big science.
Right.
Today, our big science is going to be a number of people, 500,000 people in a study. It's not just going to be a study where you are a study subject. You and me and whoever is involved in this study is shooting towards, literally, for the first time, 20, 30 years from now, a cure of cancer. 20, 30 years from now, perhaps a structure of how obesity works, how hypertension, how heart disease works, because all of this is going to be in that blood.
Yep.
I think it's anyone who says, I want to help when it comes to the fight on cancer,
this is
roll up your sleeve if you're
this is your chance.
Roll up your sleeve if you're between the age of 30 and 60, and come on down.
Because I love it. You know, I was reading some of the track the evolution of changes in obesity, nutrition, etc. Identify new risks of cancer due to change in environment. We know that lifestyle management and new technologies, and expand your knowledge of cancer risk factors in diverse populations. So what a great tool this will be. And the nice part about it, Amber, is that people can participate. How can someone join the study?
To join the study is so simple. You go online, you go to cps3neworleans.org.
Okay.
It will give you locations. It will give you times that the studies are being conducted. You will find the location and time that best fits you. You will sign up for it at that time. We're asking you to do it today. The reason is we want to fill these slots and make sure everyone's out in a certain amount of time.
Sure.
You will then be sent a questionnaire to fill out, just telling a little bit about what meds you take, your lifestyle, a little bit about your family history. Yeah. You will go the day of the study, and that's the simplest time. It's 20 to 30 minutes of your time, that's all. You will then take a waist measurement, answer a few other questions, and have blood drawn. Yeah. Then we're asking them to be long-term commitment. And the long-term commitment is the one that are actually going to give us the result of the study.
And it's going to be absolutely fantastic. And the nice part about it, this is open to anyone in the United States and Puerto Rico, correct?
Yes, correct. And the study here in New Orleans is being conducted September 11th through the 16th.
Yep.
It's on the East Bank, the West Bank. We have it at Greater St. Stephen's. We have it at 2 YMCAs. It's at West Jefferson Medical Center. We also have it at East Jefferson Hospital. And the American Cancer Society Volunteer Office.
Nice part about it, if you didn't catch all that, you can go to cps3neworleans.org to find out where these appointments are, how to schedule an appointment.
Yes.
Also, you can call 1-888-604-5888. I think I got those 8s right.
You did.
cps3nola.org for more information about that. I'm sure for you, Dr. Terry, this seems so to make so much sense now, but technology and advancements have gotten us to this point that we can really make a difference here, a game changer.
It's an absolute brave new world.
Yes.
And the critical thing is, because they have the blood, they will be able to determine sophisticated studies a decade from now that we haven't even dreamed of, and treatments and therapies that we haven't even dreamed of 30, 40, 50 years from now, just like 50 years ago. People will be going, I can't believe they did what they did to try to cure cancer.
Right.
Because things change.
Yeah, absolutely.
And they change so quickly now. And this is just, I have to tell you, being 68, it really excites me to have seen the changes we've already had to the changes that are now about to happen.
Potential, yeah.
It is astounding. But again, I have to stress, we'd like to have 550 people from this area. That's not a lot of people.
No.
That's not a lot of people. I would like everyone out there who has a relative with cancer to think very seriously about how they would like to stop for their children, their grandchildren, their great-grandchildren, from preventing them from getting a cancer.
Hearing those words, you have cancer. You can do it. Everybody, you can participate. So to make appointments.
Well, not everyone. If you've had cancer before, or a non-skin cancer that's a melanoma, you can't participate. But everyone else, or over the age of 60. 65. I can't participate.
To make an appointment or for more information, you can go to CPS3. But I was thinking of the Hornets for a second, former Hornets. CPS3neworleans.org or call 1-888-604-5888. Thank you so much, Dr. Terry Amber. Great to have you here and all the love you have for the American Cancer Society. Dr. Terry, for what you're doing at Tulane, thank you very much. And everybody really wants you to get involved. Do your part. If you don't mind, go to cps3neworleans.org and do your part. Thank you very much for watching this segment of Cox Connections. We'll see you next time.